So first I'd like to thank the organizers of this conference for putting psychiatric euthanasia on the agenda, because I know it is one of the most sensitive and controversial topics, and although it is legalized in Belgium, it is still subject of many heated debates between the opponents and the proponents of the law, and especially during the last few years, I think their voices have become louder and louder, and they are pleading not only to the government, but and they also had cases from the media exploited. They plead to, they are ranging from stop allowing psychiatric euthanasia over introducing some more stringent procedural criteria, over just keeping everything as it is, to even extending the law for other vulnerable groups. But what I think is the most interesting is that their argumentations are often merely based on emotions rather than on facts and figures. And if I'm speaking in name of the psychiatric patients, now today we know very, very, very little about psychiatric euthanasia and requests and procedures. We know that it's that their euthanasia request can be granted and can be performed. Most of these patients are not expected to die within the foreseeable future, so they have to follow some extra procedural criteria. So they have to consult not one, but at least 2 physicians to give their formal legal advice on their case. One of them has to be a specialist in the disorder, so most of the time that's a psychiatrist, and a waiting period of 1 month between their euthanasia request and the performance is mandatory. The second thing we know is, thanks to the biennial reports of the Federal Control and Evaluation Commission on Euthanasia, a mouthful. You see that in the first lustrum of the euthanasia law, it was virtually non-existent, but that changed from 2008 onwards. And then you saw in the second lustrum and the third lustrum that the number of performed psychiatric euthanasia cases increased steadily. And according to the latest official reports, approximately 40 patients per year, psychiatric patients, die by means of euthanasia. To put it all in perspective, it amounts to 1.8% of all performed euthanasia. So they are representing a slight minority. However, these are only the reported and performed euthanasia cases, because we don't know how many patients have requested euthanasia. We know from some Dutch and Flemish studies that physicians feel reluctant to perform or to guide these kind of patients through euthanasia procedures. So we actually don't know how many patients request for euthanasia, how many of these requests have been granted or simply refused or denied. As of today, we only have one quantitative study from one psychiatric clinical practice, and that was a study about euthanasia requests and procedures and the outcomes of 100 psychiatric patients requesting a psychiatrist for euthanasia. And what was very interesting in that study is that after a follow-up several years later, it appeared that 35 patients died by means of euthanasia, but the others didn't, because their procedure was still ongoing. And yeah, I'm sorry to put emphasis on it, but people sometimes think you go to an end-of-life clinic and you go out and you have a granted euthanasia request, but it's not that simple. So 2 or 3 or even 4 years later, some of these people's procedures were still going on. Some patients even canceled their procedure just because knowing they had the option to proceed with it and to end their lives gave them the strength to carry on and to give other alternative treatments a fair chance of success. Whereas other patients, there were 6 of them, even some with granted request, have committed suicide. So it would be interesting to know whether that has anything to do with their experiences of unbearable suffering. We did, actually, as of today, we didn't figure it out yet, but the psychiatrist of that clinical practice, she had 26 testimonials in the medical files of the patients, and these testimonials described the nature of their suffering and what made it so unbearable that they saw no other option than asking for euthanasia. And so she made these testimonials anonymous and sent it to me and another research for qualitative analysis. But first, I'm going to give you some information about these patients. So most of them were female, living alone from a very low income due to professional inactivity. And most remarkably, most of them suffered from more than one psychiatric diagnosis. So in the results of our paper, we stopped at diagnosis number 5. But there were patients, but really, it is true, that had more than 5 diagnoses, but we had to stop anyway because... And after a follow-up, I think 4 years later, the psychiatrist called the treating physician just to ask whether these patients were still alive or not. And after all these years, we saw that 12 patients were indeed alive, whereas other 12 died by means of euthanasia, 2 by suicide, and 1 who had her request granted, by the way, she died against her will by palliative sedation. And that was at the terminal phase of anorexia nervosa. And now, for the nature of the suffering, we distinguished 5 aspects of suffering. So we have medical, interpersonal, societal, and existential aspects. And it seems logic, and it also is, that these patients were indeed suffering from the symptoms of their disorder, but these were not only psychological symptoms, it was more than that. There were also physical, psychosomatic, cognitive, and even aesthetical problems. But other than suffering from the symptoms of the disorder alone, they were also suffering from the negative effects of treatment, like over-medication. There were patients, and that's plural, who have written down that up to, and I'm not kidding, up to 20 different types of medication. And that was not only to cure their illness, but to cure the side effects of the side effects of the side effects, and so on. So, but on the other hand, there were also patients who were, as I call, treatment resistant. So there were patients who followed a series of several sessions of electroconvulsive therapy, and it had no effect at all. And they were also suffering, from, how do I say it correctly, poor patient physician communication. I think that's friendly said. So they reported that especially when they had several diagnoses and several physicians, that it was very hard for them knowing that these physicians were arguing and had different opinions on treatment and even on diagnosis. That's very confusing. And also during the actually not only during the euthanasia procedure, but it was just so difficult to find physicians willing to listen to the meaning of their death wish, on just why they want to die, let alone to guide them through the procedure. And other than that, some patients reported that they were simply misled by their physicians. There were physicians who said that euthanasia was only legal for the mentally ill, so they could forget it. There were also patients, and that I find very shocking, that said that they had a euthanasia procedure ongoing, and then the physician said, threat these patients with involuntary commitment in the psychiatry ward. And if they went on with their euthanasia procedure. So these things happen, although it's legalized in Belgium. Okay, but other than the medical aspects, there were also interpersonal aspects. And these patients reported really horrific traumatic events that happened to them in childhood and repeatedly also in adult life. And there were traumatic events on psychological, physical, and sexual level. There were even 2 patients who had declared to be sexually abused in the psychiatry ward. But they also developed some self-destructive thoughts and behavior, including suicide attempts, which they survived and were very ashamed of afterwards. But they also perceived some, what I called internal shortcomings, but I do not believe that's the right term. But they felt reluctant to have harmed their beloved ones with their problems in life, with their difficulties in life. But on the other side, it was also difficult for them to open up and to confide others in what they have been through in the past and what they still go through now. And on the other hand, when they did, they felt not completely understood, not even by their beloved ones, because their history is so huge. It's only, you can only understand it if, you have been through it yourself, I guess. Otherwise, there were many difficulties in their social inner circle as well. Because of the difficulties, it led to many conflicts and ruptures with others, and also losses in the end of others. But on a more societal level, they also felt some struggles with social interaction. And as a part with social interaction, because they had difficulties to conform to the social norms and the social expectations on the one hand, and that was also due because they had some work-related issues. Many of them lost their job, and it was very hard, or even sometimes impossible, to find a new one. It's difficult to find a job that has suitable work conditions for them, and it was sometimes even quite impossible. Oh no! Okay, to have volunteering work. Okay, so in some of all that, their suffering experience became existential. So they felt like they had no meaning in society. They had no role to play, and that became that turned out in feelings of we have no place, in society, and we have no meaning in life itself. So they did not only fear life. They were not only tired of life, but they were simply through with life, as they had no hope of improvement, and they lost their hope. And for the extent of suffering, the degree of suffering, they really suffered from severe symptoms that were constantly present or constantly alternating. And I mean, like, going on from the one depressed episode to another, or from one phase of anorexia to bulimia, forward and backwards. And that started at an early age, and it was still going on, and that it progressed and it worsened. And it's, till they had no perspective, no purpose in life. But I think what's really important is that to know that they do not suffer from one aspect alone, and not only for the disorder, but they say the real clincher is the accumulation of all these factors together that brought them to the phase that they felt like is beyond our capacity to cope anymore. Oh, Hannah, I have to quit. Is it? Yeah. Okay, well then I refer you to our paper where there is many more information to read. And I also want to end with and now I'm not talking as a researcher, but more as an individual who had done some volunteering work in an end-of-life center, and I have had many conversations with patients, and many of them said to me, the day that I encountered physicians willing to guide me through the procedure, and especially when they had their euthanasia procedure granted, they said that was the day that I stopped thinking about suicide. I even have 2 friends in my social inner circle who said that day I stopped cutting myself. So I hope that if there are members of countries who are considering euthanasia or other options of medical assistance in dying, I hope you will consider and you pay attention to the voices of the psychiatric patients, because I honestly do believe that it paradoxically might save lives. Okay, thank you very much.